driven up to the...
Thank you. Good morning, everyone, and welcome. My name is Patricia Flynn. I am honored to be the president of the Board of Trustees for LA Leukemia and Lymphoma Society, and it is my pleasure today to welcome you to the third annual Blood Cancer Conference sponsored by LLS's California Southland chapter. On behalf of the Board of Trustees, I say very warm welcome to you. As many of you know, a diagnosis of blood cancer brings many daily challenges. The mission of Leukemia and Lymphoma Society is to find a cure for blood cancer and to improve the quality of life for patients and their families. We're finding a cure. We're not screening, we're not doing anything else, we're finding a cure. Today is a very important day. This is where our mission pieces come together. We get to invite you to meet researchers face to face and ask questions, learn all you can. This is really where our mission rubber meets the road. So we're very happy to have you here today. You're going to hear directly from those who are on the front lines of advanced and promising research. You will attend in-depth breakout sessions that are disease-specific and focused on improving quality of life for patients and their families. We invite you to be informed, inspired, and take charge of your health. At this moment, I'd like to recognize some of our sponsors and supporters who have helped make LLS and this conference a reality. So first, our local sponsors: Amgen, Eli Lilly, Onyx Pharmaceuticals, Boehringer Ingelheim, Seattle Genetics, there we go, Gilead Sciences, Inc., Metzger Law Group, and Sigma Tau Pharmaceuticals. We also have some national sponsors today: Celgene, Millennium, the Takeda Oncology Company, Genentech, and Biogen IDEC, and Teva Oncology. I'd also like to say thank you to our transportation sponsors, Santa Barbara Airbus and Cottage Health System, for helping make it possible for our guests from Santa Barbara and Ventura to join us here today. Hail to the bus drivers. For a complete list of our supporters, please refer to your Cancer Care Notebook. I think you all got a copy of that when you registered today, which also includes information on today's agenda and sessions, space for note-taking, and a list of our exhibitors. Please visit them when you have a chance as well. While the Cancer Care Notebook has resources pertinent to today's conference, it's also designed as a tool you can use following the conference to help manage your care. Now, it is truly my pleasure to introduce Dr. Amanda Turmulin, a fellow Board of Trustees member, who will serve as MC for the rest of the conference today. She is the medical director of the Jonathan Jakes Children's Cancer Center for Miller Children's Hospital, and she's also a professor of clinical pediatrics at the University of Southern California's Keck School of Medicine. Please join me in welcoming Dr. Amanda Turmulin.
Thank you so much, Pat, and welcome everyone. Thank you for the warm welcome. We have a lot of information to cover today, so we're going to start with a really mundane piece of housekeeping. Please silence those cell phones. Put them on mute. All right, how many of you were at one of our previous blood conferences? Great, welcome back. And to those of you that are new, welcome. This is going to be a very exciting day. At the end of today's conference, you will be able to list strategies that help you make informed decisions about treatment. You will be able to explain strategies to manage your disease or your family member's disease and treatment side effects. You will understand better the importance of having a survivorship care plan, including a treatment summary. You will be able to describe strategies for managing ongoing survivorship issues such as fatigue, chemo brain, financial, and employment challenges. You will be able to identify resources available in your local communities and how to access services at comprehensive cancer centers. And you will learn more about accessing services and programs available through the LLS chapters and the national programs. LLS is committed to the mission to cure leukemia, lymphoma, Hodgkin's disease, and myeloma. And as we share throughout the day, to really improving the quality of life for patients and their families. LLS exists to find cures, to ensure access to the best available treatments for all blood cancer patients. Our hope today, as Pat mentioned, is that you will leave here informed, inspired, and ready to take charge of your health. It is now my pleasure to introduce Scott Ricco, LLS's Senior Vice President of Patient Access, Education, and Advocacy, who will share more information about what LLS is doing to ensure cures and access for blood cancer patients. Please welcome Scott.
Thank you for the introduction. Thank you for the invitation to return here. I saw many of you here, I think, last year, and I'm thrilled to see even more folks in the room today, so that's fantastic. And I think American Airlines thanks you for inviting me as well. I want to start in just a second with a short video, but before I do that, I just want to thank everybody who makes this event possible, certainly from the local and the national sponsors, but in particularly the staff and the volunteers who make this kind of event possible. The logistics of putting something like this together are certainly significant, and just a hand and a hats off to all the folks who made this possible. So without further ado, a brief video on advocacy and policy at LLS, and then I will try to get into a little more detail on some of the issues raised in this video.
When you hear the word chemotherapy, you automatically know that you have cancer. And cancer is a dirty word. It's a confusing word. It's an aggravating word. And it's a word that you just want to pull your hair out and scream.
We're there to help, and so that's my role, overseeing access, to make sure that we have a team of people who can help a patient or a healthcare professional with any need they may have in their journey.
I'm too young. I got these kids I have to raise, and my wife, is a teacher, and what is she gonna do?
Every 4 minutes, a patient is diagnosed in this country with blood cancer. That's a lot of patients who have a need. Onslaught, new diagnosis, what do I do, where do I go? We have 56 chapters across the United States where we have people on the ground locally to help patients. So we have staff both in the local chapters and in our access and education specialist team to help patients understand the questions they may need to ask. You want to reach out to the physician and say, how do I make the most of this visit and understand what my choices are? Because I have to think now about treatment choices. Financial challenges are probably one of the biggest challenges, if not the largest challenge patients face trying to get access to the care they need.
The only way that I knew that it was an experimental drug is when my insurance didn't cover it. I'd get a bill in the mail for $3,000 for 5 pills.
So you can imagine, it just is a overwhelming barrier for our patients to get access to these amazing new therapies. And so we put together what we call our copay fund, basically assistance program. We provided last year more than $44 million in assistance to patients to help them be able to get access to the care they need. You think something is FDA approved, basically, and it's available to all the patients who need it. And the reality is, it's just not true. What do you mean there's no drug for me? And what do I do in that scenario? We've invested dollars in putting together a clinical trial matching software piece so that when patients call, we can get a lot of information and look at potential matches for them in clinical trials. I can tell you where to go.
They came in and asked us if we were interested in going into this clinical trial. Of course, you really don't know what that means, other than what you hope it means is we're trying a new treatment that we think is going to be better than the current treatment.
And which path you go down makes a big impact on outcomes.
Early January was my first Gleevec pill. I got the first cytogenetic response, and I went down to 5% Philadelphia chromosome. That was fantastic. This was just the sign that said, this is really working, and I was there.
But then there is organizational advocacy, and we ask our patients and our volunteers and our healthcare professionals to engage with us to drive better public policy so that we can do two things: accelerate the pace of new treatments and cures. Research has driven this organization since its inception. We've spent almost $1 billion funding new treatments and cures, driving them forward. If we can bring the voices of those patients waiting for those new treatments to the regulatory process, speed that process up, make it more efficient and effective, and then once these drugs are approved, make sure that they get covered, that patients can get access to them as part of what we call quality, affordable, coordinated care. The thing I would like the public to see is how much hope there really is, how much progress has been made.
I have a daughter going to college now. Back in 1964, I wouldn't. Things have improved, the treatments have improved, the survival rates are way up, which is great, and the society can take a lot of credit for funding those type of things.
The research that the Leukemia and Lymphoma Society funded for Rituxan, which was one of the drugs that I took, helped make the survival rate what it is today.
Progress in blood cancer has turned out to be a great gateway to progress against cancer at large. We know that in the last decade, more than 40% of all of the cancer drugs approved were originally approved for a blood cancer. And we really are on the cusp. We always sort of say we can see the end of cancer from here. But it doesn't end itself. And I think that's the critical aspect, that we all have to get involved. Numbers matter, voices matter, effort matters. There's a lot of ways to be involved. We have an advocacy webpage on our website to sign up and get involved, and sometimes it means writing a letter, or sometimes it means making a phone call or sharing your story with us. Cancer does end with you. It ends with you taking action, getting engaged, standing up and saying, yes, I care about ending cancer and I'm going to do it. I'm going to be part of that. We stand at that precipice, basically, with the opportunity to end cancer as we know it today. See if I can make the clicker work if we get the presentation back. Well, bear with us for just a second. There we go. Perfect. Thank you. Let's see if my there we go. Good. Thank you. So, somebody wisely told me when you give a presentation, start at the end and tell people what you're going to tell them, and then tell them and tell them again. So, that video for me is really what I want to emphasize. A couple of important issues. There is a great deal of hope. We have made incredible progress. My favorite line in there is that, I have a daughter in college today, and in 1964 I would not have. That's powerful. That's progress that as an organization and as participants and supporters of an organization, you have helped make possible. But the job's not done. Survivors are living longer, dealing with new challenges. We need better treatments and cures, and we need better access to them. So I'm going to talk a little bit about what we're doing as an organization and about how you all can be involved in helping us drive that. You've heard certainly our focus as an organization. It's about cures and access. It's about being the voice for blood cancer patients and making sure that everyone who needs to hear that voice to make sure we get cures faster and we get better access now, hears those voices. Dr. DeGennaro is going to talk a little bit later about the research that we focus on, so I will leave that off, although it's certainly an amazing story. I'm going to focus on that bottom section about how we advocate for blood cancer survivors, their families, how we help patients navigate through their cancer journey, and how we help ensure that they have access to quality, affordable, coordinated care. So how as an organization do we make cures and access happen? Again, the left side of this drug discovery, development, and access path, Dr. DeGennaro will talk more about this afternoon. I'm going to focus on the patient access side. So the first thing, just in a very quick highlight, the patient professional programs and the financial assistance that we provide. We know that information and support is a critical barrier to access for patients. If they don't have the information that they need about what their treatment choices look like, they don't get the best care, and they don't get it in a timely fashion. So we have trained specialists in our Information Resource Center. They fielded more than 60,000 inquiries last year to help patients navigate their journey in some way or another to get from where they were to the care that they needed to live longer, better lives. We have local in-person support. Every chapter that we have across the country has dedicated personnel to help patients in their journey, to help them find the resources that they need to get access to the care they need. Wonderful programs like the Patty Robinson Kaufman First Connection program to connect a patient starting perhaps a journey with a patient who's on the other end of that journey, further along in the path, and can help that patient understand there's hope. There are others like you. I can help. We serve patients with education as well. In fact, this is a great example of that. You're going to hear today from key opinion leaders, researchers, providers of the best care about new treatment choices, about the hope that exists for patients and their families today. We do that through events just like this. We do it through national webinars, a host of opportunities to make sure that both patients and professionals are getting access to the latest and most important information about their treatment choices. And we help patients financially. We know that, as I mentioned in the video, one of the most significant barriers for patients getting access to the kind of care they need is financial. 7 years ago, we started a copay assistance program, and I am proud to tell you that last year we provided more than $44 million in assistance to patients in need. We helped, thank you. That was more than 13,000 patients who were able to get access to care who would not otherwise have been able to do so. And we are committed to growing that program and providing additional support to patients in need. So now I want to turn a little bit to the policy agenda side of it. You know, as an organization, a number of years ago, we took a hard look at the progress we had made and can say we're very excited about patients living longer in many of the cancers that we serve. But we also know there is a great deal more to be done. We know that we need to do more as an organization to speed up the development and ultimately the approval of new treatments and cures. We also know that we need to do more as an organization to make sure that our patients can access those new advances, that they weren't just academic exercises in interesting science, but that patients are actually able to take advantage of those innovations and truly live longer, better lives. So from a policy agenda perspective, as the access team at LLS, we did a couple of things. One is focus on building a relationship with the FDA, right? The organization responsible for how long that development and approval cycle is and what the hurdles are required to get through, so that we could bring the voices of our patients and our researchers into that development process, so that they could understand what a patient is thinking in terms of risk, tolerance, when they're faced with a certain treatment choice, so that they could understand what researchers are telling us about what they need to get these drugs approved more quickly and effectively. We advocate at the state level, at the federal level, to ensure access to that quality, affordable care, and we look for every opportunity to bring the voices of our patients into those processes, whether that's through some patients getting involved with advisory committees at FDA or with Health and Human Services to be a patient voice in the process, or to testify at a state hearing on access issues, or to come to Washington and share your story with a legislator or go meet them in their local offices. We want your voice in this process. So I mentioned organizational advocacy in the video. You know, what else are we doing? As an organization, we are building relationships beyond FDA, also with the Center for Medicaid and Medicare Services, because they are responsible, they are the largest insurer in this country. And so we want to make sure that when they're thinking about providing access to care, that it covers the kind of care that our patients need, because we know that so many private insurers will follow their lead. We're spending time with legislators and regulators focused on challenges that our patients are having. We know, I mentioned non-compliance on here. What that means is, in the healthcare law, there are regulations that say insurers can no longer discriminate against patients with pre-existing health conditions. They also are not supposed to discriminate against patients with high-cost medical needs. But unfortunately, we've seen insurance plan designs that we think do just that. And so we need to point those out case by case and work through the process to make sure those are eliminated before our patients have to suffer because they can't get access to the care that they should be able to access. So we're working on gathering data. It's important as an organization to build credible relationships with regulators. You've got to have good data. So we're gathering the data. We're gathering the stories, your stories. These are so important because data by itself doesn't have a life. When you have patient stories to bring that data to life, suddenly it has great power. So we need your stories to help us bring that data to life. And we are spending a great deal of time internally and externally continuing to do training as the healthcare landscape evolves so that our staff is best equipped to help patients and their families when they come to us. So we talk a little bit about policy, we talk a little bit about advocacy. I want you to know, as an organization, one of the things that I think truly differentiates us is a robust effort in both. Many organizations are really focused on one or the other. So there are wonderful policy-focused organizations, but as is often said, policy without advocacy is a think tank. Well, we certainly don't want to be a think tank. It's nice to have those interesting discussions, but at the end of the day, why do we have them? Because we want to drive better access to care, and that's where the advocacy piece comes in. But advocacy without policy, I think in a lot of times, and I've lived in advocacy for a number of years, can be, if you don't have a policy piece, advocacy can be chaos, can be screaming, thumping your chest, yelling, we want more, without offering a solution. So as an organization, we are committed to driving forward and offering solutions, and then bringing the people and the stories and the data to bear to drive those solutions forward. We want to work together to advocate for access and really change policy. So we have a policy team. Thea is sitting in this room in the State Government Affairs. Hi, Thea, say. She is the Pacific West State Government Affairs Manager, and so she is focused on understanding in all of the states that she covers the laws, the regulations, the gaps that exist for our patients, and identifying and proposing solutions. She is focused on building relationships with policymakers. And then we have folks like Aaron Aaron, say hi. Aaron. Aaron's responsibility across the same region is to build a team focused on gathering the data, gathering the stories, and recruiting and training the Army. You have to have an army of people. Numbers matter. When we get a policy solution, how do we make policymakers understand that it's important to their constituents? We bring the people, and we bring the data and the stories. So where are we focused in 2014 from a policy perspective? Just a couple of quick highlights. As you could imagine, the Affordable Care Act is where we're spending a lot of our time trying to ensure that as it continues to evolve and roll out, that our patients are being taken care of. There are significant issues, and frankly, they extend beyond the Affordable Care Act, I would say, to the insurance market in general, around transparency, trying to figure out whether a particular plan will cover the kind of care you need, cost sharing. I'll talk more about these in a minute. The top right-hand care issue, there's a couple of particular Medicare reform opportunities for us. The bottom left, and again, this is Dr. DeGennaro will talk a little about our research efforts. This is the part of our focus from the perspective of speeding up that timeline, trying to get new treatments to patients more quickly and more effectively. And then the bottom right are other issues that are timely and ripe for us. The very first bullet, for instance, pediatric research funding. We have been driving, those of you who are already in our advocacy network have seen alerts over the last month and a half, trying to drive support for a Kids First Research Act to drive greater funding for pediatric research at the NIH so we can get some additional dollars there. And because of the actions of our advocates, those folks who have written letters and made phone calls, we have gotten it moved forward in the House, and now we're working on the Senate side. So there are particular opportunities for us to drive better care forward there as well. So in the insurance market, and again, you may be familiar with many of these issues, unfortunately yourself, there are a couple of highlights for us. And again, I say insurance market because you should know that, people say, well, did the ACA change things, good, bad? These issues that I'm highlighting here existed long before the ACA came to be. Some of them have been accelerated or highlighted within the ACA, but they're concerns for us in the insurance market in general. Benefit design, what does that mean? What that means is, as an insurance company, when you design a plan, basically, how do you treat when a patient needs to get access to care in terms of what does it cost them? If you go to fill a prescription medication, do you have a $20 copay? Or do they charge you 30% of the price of the drug? That's a benefit design choice, and you could imagine the tremendous impact that that choice has on patients' ability to access care. Network adequacy. That issue is, can you go see your doctor? Are they in network? Can you go see the specialists that you need to access to get a second opinion or to move your care forward? Is the local comprehensive cancer center in network for you? Is the pediatric cancer hospital in network for you? Because if they're not, most people aren't going to be able to access that. So is the network adequate for you to be able to get the kind of care and access to the kind of specialists that you need to win that fight? Breadth of drug coverage. This is another important area, right, for our patients. When you and your physician sit down and talk about your treatment choices and you make a decision about what's the right treatment choice for you, can you get access to it? Or does your insurance plan say, well, you could have that drug, but you have to try and fail on this drug, and then try and fail on that drug, and be exposed to the side effects from those before you can get to the one that you and your physician think is the right one for you now? That's a problem. And finally, premiums, as you can imagine. Just what does it cost to get insurance in this country that provides the kind of floor for coverage that our patients need? If you have stories about challenges with any of those issues, share them with your local chapter folks or email them to us. I always say the email address is easy to remember. If you remember what we do, Advocacy, and where we work, LLS, you can send us an email. It will come right to our office in DC, and we can capture that story. Help us by sharing your stories. What else are we doing? Education. Certainly training, as I mentioned, is a key component for us. Raising the level of understanding of our own staff so that we're better prepared to help our patients when they call. We did put together an internal training webinar on the ACA and the issues within it. We've made that available publicly, so it's available on our website if you want to watch it, if you have questions. We've done expert training on some insurance issues for our key call center staff and our access leaders, and we're providing regional education forums as well for patients and community groups to help them understand where are the challenges and how can they have a voice in driving better access to care. What else are we doing? I mentioned data collection. This is critical for us. We recently completed a study. We hired an actuarial firm to do an analysis in 4 states of every plan in that state health exchange and understand the challenges within them. And as I mentioned, not surprisingly, there were huge holes in network adequacy. There are plans in the state of New York, for instance, that provide access to 0 out of the 7 comprehensive cancer centers in that state. That provide access to 0 out of the 11 transplant centers in that state. If you had that plan and you needed care, what would you do? You're out of luck. So fortunately, they're not all that bad, but it's an example of it's a challenge to know, and unfortunately, this is where the transparency comes in, it's very difficult sometimes to tell before you purchase that plan what sort of coverage you have. And I give you a great example. There was a letter to the editor, excuse me, in a story highlighted in the LA Times about a week ago, I think now. And this was a lymphoma patient here in California who had spent a great deal of time on the phone and conversing with the insurance company to ensure that her oncologist was in network. She had been repeatedly assured that that oncologist was in network. She got into the plan and they told her that that oncologist is out of network. Now she can't get access to her physician. That's a huge challenge, and it's a transparency problem. Whether it was intentional or just a lack of good data available to the person she was on the phone with, that is a critical issue and creating a huge hardship for her. So we need better transparency. We need better networks. And then we need to deal with these issues around cost sharing and deductibles. We saw deductibles in bronze and silver plans that were more than twice what they are in the same size insurance market and private employer plans. We've seen plans with deductibles that are basically the same as the out-of-pocket limit for a patient in a given year. Deductibles of $5,000 or $6,000. So that a patient is forced to pay that $5,000 or $6,000 before basically the rest of the coverage for the plan kicks in. There are an awful lot of our patients who couldn't afford that. So we need to fix that issue as well. Organizational advocacy, as I mentioned, we are out advocating. Thea is meeting with regulators. We have a federal team who's meeting with regulators and legislators. We're focused on pushing for greater transparency, whether those are sometimes legislative solutions, sometimes regulatory solutions. We are focused on improving network adequacy. We need the specialists that our patients need to be available to them in network. And we need better benefit designs. We need to find ways to reduce the out-of-pocket exposure for our patients from these 30, 40, 50% cost-sharing burdens that some of our patients face that put those kind of innovative therapies completely out of reach for them. And we know it can be done. We've, again, gathered some good data that suggests that very small changes, smart benefit design, can make those other benefits available to our patients without pushing additional costs to the insurance company, without pushing additional hikes in premiums, just better benefit design that considers the needs of our patients. And then we're hosting several state-specific events. California, we held one relating to Covered California in conjunction with the folks at Komen. We've held one in Maryland and Pennsylvania, and we'll continue to host those. Why do we do those? It's an important opportunity for us to educate patients and regulators about the challenges of the choices they are making or the choices they have in front of them from a policy perspective. If you're sitting in the audience and thinking, I need some help with this because I'm challenged by what kind of information I might be buying insurance through the health exchange, or I just had an insurance issue in general, we do have a whole page, a whole section of our website dedicated to ACA issues, and frankly, as I mentioned, many of these ACA issues really apply to the larger insurance market. So we have a great number of resources there, as well as a link to that Milliman, the actuarial study that I mentioned, so it's available to you if you want to dive into it and ask us questions. Where else to find help? People. As I mentioned in the video, we're here to help. So if you're out there thinking, geez, I need some help understanding these issues better, you can call us, call our Information Resource Center, talk to one of our specialists. You have folks in every local chapter. You can, if you don't know who they are, you can go on the website and search for your local chapter, but I suspect if you're here today, you probably know who those wonderful folks are. Reach out, ask for help us get connected to you so we can help you find the resources and the information you need to be able to make the most informed decision. So as I promised, how can you get involved? So I talked about our organizational advocacy. Where are the opportunities for you? Well, as I mentioned earlier, numbers matter to us. You know, you have to, if you want to make a change in a legislative, in a bill, for instance, you have to be able to turn out people, because every legislator needs to know that they have constituents in their district who care about this issue, who are informed on it, who are educated about it, and who are paying attention to what that legislator does on that bill. So the more of you who get involved, the more of you who sign up and get educated with us, the better the chances we have of driving success. I'll give you a good example. We recently, again, in moving this bill forward in the House to increase research funding for pediatric research at the NIH, we generated just north of 10,000 letters in our last alert, and we were able to get that bill passed in the House and moved to the Senate. That's the kind of place where numbers matter and can make a huge impact. So that bill is moving. It wasn't going anywhere without our involvement. Share your story with us. As I mentioned, stories bring this data to life. We need more stories of the challenges that we know you're experiencing every day getting access to the care that you need. Share those stories with us. Again, whether with your local chapter folks, email them to us at advocacy@LLS, call Thea, call Aaron, call their teams, but we need those stories. We have so many more opportunities as an organization as we continue to wade further into the regulatory and policy arenas. We have opportunities to bring. We had a patient who let us know her story, and we were able to put her in front of the House Energy and Commerce Committee in DC to testify about the challenges she was facing with pre-existing conditions getting access to insurance. That was powerful. That was a story that those legislators needed to hear. And if we hadn't known about her, if she hadn't raised her hand and said, I have a story that I'm willing to share, we wouldn't have been able to take advantage of that opportunity and move that case forward. There are opportunities at the FDA if you have a particular interest in science, in the development pathways. FDA is looking for patient representatives, and we have the opportunity to nominate patient representatives to various committees. We know there are legislative and regulatory development meetings that we're having all of the time at DC and in every state. So there are opportunities to get involved there. And then we have federal mission day, we have state mission days. There's all sorts of opportunities. Find a way to get involved. You can make a huge difference. There are opportunities for letters, phone calls, social media. If you're interested in being involved, you want to make a difference, you raise your hand and say, I'm interested in advocacy in some way, we will find a way to line up with what you want to do to make a difference. You can follow us on Twitter. Most importantly, the email, advocacy@lls.org. If you have a story, you want to be involved, email us, let us know. Go to the website, lls.org, advocacy, sign up. The more people we have in our network who are signed up to get our information alerts, to get our requests for stories when we have short-term opportunities, to get a media opportunity or a testimony opportunity, the bigger the network we have to go out to, the better chance we have of being able to follow through and find that story, find that right patient, right time, right place, to make a difference. So you can help make that possible. We can't do it without you. As Lou often says, you know, he can come out here to California and testify till he's blue in the face with a California legislator. He's from Connecticut. They don't care. But they care about you. They care about their constituents. So if you come with him, very powerful, very strong. Let us know you want to be involved. And what does success mean for us? Why do you care? So at the federal level, let me give you a great example. In 2012, those of you who came to Mission Day or were somehow involved in our Mission Day know that there was an FDA bill up for discussion, and our organization, along with a number of other cancer-focused organizations, lobbied hard that that bill would include a requirement that FDA create something new, a pathway called a breakthrough therapy designation, so that truly innovative scientific breakthroughs that addressed unmet medical needs for our patients could find a faster path to the patients who needed them. Fortunately, that bill passed after a great deal of lobbying, again, from our organization and our patients and many others. That language was included. The end of that year, FDA did what they were required to do and put out guidance language. One of the very first therapies to gain this new breakthrough therapy designation was a drug called ibrutinib for blood cancers. It's now been approved for 2 different indications for our patients. And the end result is that patients are basically getting access to this therapy 2 years sooner than they would have without that designation. 2 years is a lot of lives saved. So thank you for all who were involved in that. And at the state level, let me give you another great example. We had an opportunity not so long ago where we heard from our chapter staff in Oregon that in the health exchange, the benchmark plan, basically the primary plan against which all the other plans that would be sold measured their benefits, had a 2-year waiting period in order to get a bone marrow transplant, meaning you had to have coverage for 2 consecutive years before you could get a bone marrow transplant. Many of you, yes, all of you who are familiar with this issue understand that that would be a death sentence. This was completely unacceptable. So when we found out, we began meeting with state legislators, regulators. We began calling on the Center for Medicaid and Medicaid Services and HHS in DC. We had a very powerful patient story that we were able to get media attention and gather a lot of local attention to this issue. And the net result is within several months, we heard recently, I don't know, about 3 weeks ago maybe, that waiting period has been lifted and that they will move forward with plans with no waiting period in Oregon. Again. But neither of those examples, and there are many others like them, are possible without involvement from all of you. It's great to have a staff person dedicated to calling on those legislators and regulators, but you have to have patients who are willing to stand up and share their story. You have to have constituents in legislative districts who are willing to stand up and say, I care about this issue and I want you as my elected representative to do something about it. We can't do it without you. What else does this allow us to do? Well, the good news is, again, as I mentioned, as we get further into the policy arena, we understand that more and more the media is beginning to see LLS as a go-to expert in policy and access issues. So whether it's issues related to new drug development and approvals or issues related to access challenges faced by patients, they are beginning to come to us, and we're seeing opportunities to get out in the New York Times and the USA Today and the Washington Post. Why do we care? Well, we care because, one, this is our opportunity as an organization to raise awareness about the issues faced by patients with cancer. As was mentioned earlier, we're not at the place today where science allows us to talk about the benefits of screening for blood cancer patients, the benefits of prevention for blood cancer patients. I certainly hope we will see that day. But today, our patients present to us with cancer, and somebody needs to be talking and raising a voice in the media about the challenges our patients are facing. This gives us an opportunity to do that. And what else can we do when we do that? Well, we can cast a broader net. There are now people who are aware that LLS is the organization that if they're looking to drive forward new treatments and cures for patients more quickly, if they're looking for an organization that's focused on ensuring patients with cancer have access to therapy, that LLS is the organization that they should advocate with. So it helps us because more advocates will help us drive more success. So we share a goal, right? Everybody in this room and everyone in our organization, a world without blood cancers. As an organization, for us, it's always about the patients. Patients first in everything we do, focusing on cures and access. Everything we do is with a sense of urgency because we know our patients can't wait till the beginning of the next legislative session for us to be working on how we're going to solve their challenges. We will collaborate and compromise, but we will not settle. And I have to tell you a very quick story since I have about 5 minutes. I saw a wonderful post on a CML discussion board less than a month ago that was shared with me. And it was a patient in Massachusetts who had gone to pick up her Gleevec prescription. And they told her that her copay for Gleevec now was $0. And in fact, she got a rebate, $248 as I recall, for past copayment provided, and was talking about what an amazing blessing this was. And she said, well, why is that? What changed? In Massachusetts, at the end of 2002, after a long fight led by this organization, after turning away a bill at the very last second that would have watered down access to care and not solved this problem, we said, we will wait for the right bill. At the end of 2012, we were able to drive the passage of an oral parity bill in the state of Massachusetts, which means that oral cancer therapies would be treated in an insurance plan the same way IV cancer therapies were treated in terms of what a patient would have to pay out of pocket, which meant for this woman and everyone in her shoes in Massachusetts, she now has a $0 copay. That story was made possible because of work of so many volunteers with a couple of key staff and a focus as an organization, but it could not have been done without the patients and the volunteers who made the trips, who gathered the stories, who made the phone calls. So again, I say we can't do it without you, but with you, we can change lives. So our ask, my ask is, Invest in us as an organization, invest with us. As I mentioned in the video, it is clear we continue to need dollars to drive new therapies forward, to drive our research agenda, to drive these amazing new therapies for unmet needs. So we need resources to do that. It's important. Invest with us. Share your time. Share your stories. Share your passion for patients and progress. You're here today as a great sign of the passion that you have for progress and patients. So please continue to share that time with us. We know that access to care is not going to get better on its own. It doesn't fix itself. It requires us as an organization and us as a community to raise our hands and say, we want better access to care and we will fight for it. We also know that the progress we have made today in blood cancer was not possible without persistent effort. So we can't just raise our hand once and say we want this and go away. We have to stick with it. We have to invest month after month, year after year, and we can make it happen. We can make somebody someday today. Thank you. I didn't talk long enough, is what you're saying? Yes. Oof. For hours and hours and hours, I could. Well, as you know, I think and it's a great question. Our perspective as an organization is clearly for cancer patients. There was some good immediately recognized when that bill was passed, right? The elimination of lifetime limits on care, annual caps by insurance companies, patients with pre-existing conditions being able to get access to care. So those were some good things. You know, the devil is in the details, and that's why we're fighting every day in terms of the implementation, because it could be great good for our patients. It could be a lot of challenge for our patients, and ultimately we're going to get to decide as a community which side we land on. Yeah.
Can you talk a little bit about what's happening in other states or at a federal level
Yep.
with oral parity? Because it seems to be very iffy state to state.
And you're exactly right. That's a great point. And frankly, a couple of just important things. Understanding that, so oral parity, again, this is the issue where we're just trying to bring consistency between how an insurance plan treats a therapy that you get access to in the hospital setting, an IV, versus a therapy that you can take at home. Right now, they're covered under different parts of your insurance plan, and they often have very different cost sharing. So we're just trying to bring parity to it. It's been a challenge. We have fought and had a number of successes in some states in the last 2 years. It is a challenge in many states. We are also, I think we're looking for every opportunity. Specialty tiers is another issue I mentioned. It's all about cost sharing. For us, it's really, it's not so much the parity, it's the fact that we know if you got the treatment in the hospital, you could afford it, and if you took it at home, you couldn't. And so we're fighting in a lot of areas, and we're also very much focused on the federal solution, because any bill that you pass at the state level only affects the insurance plans regulated by the state, which means that's the individual insurance plan market and the small plan insurance market. Mid and large employers are governed at the federal level. So even passing that bill in Massachusetts does not fix the issue in Medicare, does not fix the issue for large employers in Massachusetts, so we still need a federal fix. So we are very focused on attacking it from every angle, but you're right, it's a challenge. Thank you all for your time. I will be around all day, so if you have additional questions, I will do my thing. Thank you. Thank you.
Thank you, Scott. I hope you're all inspired to find your congressman and your senator and get involved with the LLSs. This is a really key part of the mission. If you have questions for Scott or